Our guest today is Lorraine Goddard, the CEO at United Way Windsor-Essex. Lorraine, thanks for joining us again.
Great, thanks for having me.
It's been roughly 3 months for the pandemic. You were on before, and now we've got you back. How are you and your family doing?
You know, we're still doing very well. I think, as human beings, we adapt to whatever circumstances we're faced with. And so it almost feels kind of like working from home and being somewhat socially isolated is the norm now. But we're all healthy, and that's what's important.
Excellent. The United Way is a partner in the Windsor-Essex COVID Care Coalition, working on a number of initiatives since COVID-19 started. Can you tell us about some of them, like the Windsor-Essex Food Helpline?
Yeah, I mean, it's been a tremendous success in terms of helping people who require emergency food assistance access it much more easily. As I had shared with you at our last interview, Green Shield Canada stepped up to the plate, and they had 34 of their employees who manned our helpline. And since it started, which would have been 2 months ago, they have fielded over 4,100 calls. And when you look at what the average would be per day, because the service was offered 5 days a week, it was almost 100 calls a day they were averaging. What's happened now is the call volume has definitely decreased. And that's a great sign, because that tells us that people are either more stabilized in terms of their income, or they are able to access the drive-through hubs, which has since been established and are currently operational. And so we're going to be transitioning that helpline from Green Shield next week over to 211. So folks will be directed by 211 to be able to access emergency food to the closest location to where they live. So, I just really want to give a shout out to Green Shield Canada, because not only did they give a very generous financial contribution to our COVID care community plan, but they also contributed over the last 8 weeks to support our helpline. So, that's good news for our community, and 211's ready. They're going to be able to handle the call volume, and of course our coalition will continue to monitor the situation.
And how about the Windsor-Essex Counseling Support Line?
That too has been accessed since it started, and it's been operational about 6 weeks. It has fielded 464 calls, and as a result of that, it has provided almost 200 counseling sessions virtually. So people are definitely accessing that line, and that will continue into the future, and we are again continuing to monitor and assess its needs.
Great. And also, we can't forget our seniors, the Windsor-Essex Seniors Call Assurance Program. How has that been going?
It's been going very well, too. 358 seniors are connected to the call assurance program in various communities across our region. They have made over 4,200 calls to these folks. And we also increase the support to these seniors by providing delivery of food or medication or personal protective equipment, or even activities like puzzles and find a word and things like that to keep them busy. We've delivered over 1,000 items to our seniors. So it's definitely being utilized by seniors who felt that they needed that support, or by family members who felt that their mom, dad, or grandparents needed that support.
And just a reminder, that's Monday through Friday, 9 a.m. to 4 p.m., 877-771-2677. Always want to make sure we take care of our seniors.
Absolutely.
What are the greatest challenges that you've come up with, during the pandemic?
Well, I mean, when I look at the community and what we're really trying to manage right now, I mean, initially it was ensuring access to those really critical vital services, food, mental health, isolation, housing supports, those kinds of things. We had to really get those set up. Because we didn't really understand COVID-19, how it was going to spread, the requirements that we still have to maintain our social distancing, we really were really focused on that. But now what we're seeing is some of the impacts on charities and not-for-profit organizations that provide a whole host of programs that are really critical to our social safety net. They are losing a lot of revenue. They're not able to do their fundraising. Their donations have declined, and they're trying to just manage, like, how do we continue to provide the support, whether it's to newcomers, whether it's a program for children and youth, mental health, whatever it is. What we're trying to do now is shore up these charities, because if we start to see them close their doors, those will just increase the already kind of holes in our safety net for our community. So one of the things that we are doing is we are administering the federal government's Emergency Community Support Fund. So charities that are impacted by COVID-19 in terms of their ability to support vulnerable populations are encouraged to apply for funding that can help support their work to March 31st, 2021. So both United Way and the Windsor-Essex Community Foundation are administering some dollars out to the community. So, United Way received about $1 million to administer out, and we're putting it out into two phases. The first deadline was June 2nd to apply. The second deadline is July 2nd to apply. And in the first round of applications, we received 35, and the total amount requested is over $2 million. So you can see how the need is there, and of course, we're very grateful to the federal government for these dollars, but it certainly is not going to be enough to support all of these requests. So we're going to, have to look at how do we ensure that the most vulnerable people maintain the supports that they get through these organizations. So it's going to be a challenge to ensure that, the right decisions are being made to get these dollars out to the community and help shore up those organizations that do provide really critical services.
So if any of the charitable organizations do want to make an application, and they're watching right now, where would they go?
They can go to United Way's website, weareunited.com, and the application is there. The next deadline is July the 2nd. So, there's a guideline document, everything is there. And we're really bound by the federal government's criteria and evaluation of the proposals. So we're really administering this on behalf of the federal government.
Excellent. Tell us about the recent I Believe in My Community Awards.
Well, we still like to and are so honored to be able to recognize individuals, organizations, and unions who really go above and beyond to support their community through United Way. And of course, with COVID-19, we generally would have a celebration where, several hundred people would get together in a room and recognize the great work of these folks. This year, we have to try to do something a little bit different. And so we're leveraging social media. We have videos of all of our recipients this year. And our great sponsor, which this year was Reliance Home Comfort. One of the things that we always like to make sure that our donors and the community understands is when we do throw events, we never spend donor dollars. Those are always sponsored dollars. And Reliance Home Comfort stepped up to the plate this year and supported our work to be able to raise these dollars to support vital services in our communities. So, we're just always honored to have such great community champions who really care about Windsor-Essex County. So that's what I believe in my community. We call them our believers.
Yeah.
So we want to recognize our true believers.
Has COVID-19 affected the United Way regular programs in that you've had to pivot to help out on these other initiatives?
Yes, absolutely. I mean, United Way, as you know, is the backbone organization for Prosper Us. And Prosper Us is a collective group of more than 50 system leading organizations that represent the private sector, the public sector, and the not-for-profit sector. And they've come together to advance a cradle-to-career strategy in neighborhoods where we have such a significant population of kids who are falling behind. And so a great portion of our work was we established these neighborhood tables, which the folks around these tables were people who live in these neighborhoods, who have children, who represent different racial, ethnic backgrounds, and can really speak to the impacts of all of our systems, the systemic barriers that are really preventing their family and their children from being able to advance and be successful in our community. And so we were hosting face-to-face meetings, really understanding, being a good listeners to understand what's going on, what's important to you, and what are solutions to some of these systemic problems that have been around for so long. Well, without being able to get together face-to-face, we've really had to try to pivot to connect with these residents virtually. But because many of them, or all of them, I should say, live in very low income situations, they don't necessarily have access to the technology or internet. So we've had to ensure access to all of that. We've had to train them on how to use this technology. And we've had to really figure out, how do you build that sense of comfort so that you can have dialogue and sometimes debate around some of these issues. And so we're finally starting to pick up some steam, and we're building our muscle around this. And so we have had to pivot in that respect. Additionally, United Way does deliver programs to children and youth through our On Track to Success program, and we do support quite a number of youth-serving organizations. So we've had to create what we call a community of practice with organizations to collectively build, again, our muscle, our capacity to pivot our programming to a virtual model to support kids. So, when you think about the challenge that children, particularly those who are more vulnerable and at risk, we're already experiencing going to school every day and falling behind. You can imagine how challenging it would be for these children and youth to, try to self-teach using online tools without reliable technology or technology at all. So we've really had to jump in with both feet to develop the technology, the virtual programming, so that we could support kids, and then bringing our partners along with us. We still have more work to do. And when we look ahead, despite COVID-19, I think we have to, as a community and as youth-serving organizations, recognize that children born today are born into this technology realm, and that they connect with their peers through technology more and more. So we need to develop that capacity regardless. Even when COVID-19 ends, we're going to have to keep that approach going and get really good at it, because that is our future. Not to say we're not going to meet face to face, but we got to do both. We got to do it really well.
Yeah. Lastly, Lorraine, if people want to assist United Way, you want to give us your website. So I think that's where they can help out.
Yes, absolutely. We are united, all one word, .com.
Excellent. And lastly, we always look forward to some hope. What are you looking forward to once this pandemic is over, hopefully?
Yes, I mean, I do have hope it is going to end at some point. You know, I think the biggest thing for me is to be able to get together in larger groups of people. When I think about even our I Believe Awards and having hundreds of people in a room, all kind of like in a space of positive love, caring, that is just such a powerful force, which is really hard to emulate and bring about using, technology. So being able to, come together and doing it safely without fear is probably the thing I miss the most, and look forward to the day when we can again do that.
I'm with you right along that one, Lorraine. It'd be great to get together with people, like you said, face to face. And having said face to face, I have to mention John Fairley, because otherwise he would get on me for not saying that. Lorraine, thanks for your time again. Thanks for joining us. Please stay safe and stay well.
Thank you. You too.
That was Lorraine Goddard, CEO of United Way Windsor-Essex.